Thank you so much. Hello, everybody. Welcome to today's conference on knee, foot, and ankle surgery. Just to give you a little background, and I can do this while we're showing my disclaimer on here. I work at Healthcare Information Services. We are basically a revenue cycle or billing service specifically focusing on orthopedic surgery. We are now servicing over 200 orthopedic surgeons in 3 states currently and growing. We have another client coming on in a few months and are talking to several other groups. We decided several years ago to just focus on orthopedics rather than trying to do multi-specialties. And so we've kind of come to be known as the billing service, for the orthopedic practices. Now, in that, we also service all of the subspecialties that fall under orthopedics. So we have podiatry, pain management, rheumatology, physiatry. It seems like I'm forgetting some, but we actually even have neurology now, but we do service all of those musculoskeletal specialties, I like to even say at this point. So what I'm going to share with you today areas when it comes to surgery in the knee, ankle, and foot. And it's ironic that I was just coding some foot and ankle procedures today before jumping onto this call. So I do have, while I'm not a heads down coder every day, I'm still doing that, every now and again. And I do actually also do spine coding as a part-time position, so I have a lot of background in that. So again, I want to go over these things that we're going to talk about today are things that we deal with here and what we're currently having problems with, and hopefully I will give you some information, because more than likely if we're having problems with these certain things, you're having those same problems. And then at the Q&A session, you'll be able to ask specific questions if you have any of those, which I'm hoping we do today, on things that you may specifically be having problems with. A lot of the information I'll talk about today is from CMS, and we know that CMS basically is the driver for many of the things that we deal with, because the commercial carriers, a lot of them are following those guidelines also, and they publish it as such. So we will talk a little bit about that as we go along here. So let's go ahead and get started. Now we're going to talk about knees. So I wanted to go over knees in the fact that when we're talking about total knee replacements, it seems that we have more often than any other joint, patients having complications in knee replacements. Unfortunately, I'm one of those people, but I wanted to be able to go through, there's a lot of confusion as to when do we use revision, when do we use just the total knee replacement, what other codes do we use, and I think also we sometimes have a problem because there is no conversion code like we have in the hips. And I think that we're going to eventually have to see one being created, because we do have patients that are having unicompartmental knee replacements now that down the road they're going to need a total knee replacement. And so we're going to need that conversion from other previous knee surgery to a total knee. So we'll see what happens. But now there are 2 revision codes for knee revisions. If in fact you are forming just one of the components, whether it be femoral or tibial, we're going to use the 27486. If you're replacing both of those parts, then we're going to use a 27487. Now, when we're using these revision codes and we're removing the old prosthesis at the time that we're doing these revisions, so we're basically taking out the old and putting in new, you cannot report the removal codes with those. It's already included in the 27486 and 27487. So those will